Nobody has perfect skin. Nobody. People come in
We
and
can
say
help
to
you a
me,
lot though, don't I need your DVLA check code. I was like, Dan was looking at me like, I said, well, you could have done it.
You know, I'm a great face washer.
It's like when I went to Paris, in my suitcase just packed a leotard.
Come with me in the study and close the door and don't let your daughter in. My daughter being your mum.
I saw him peeking through the door at me. I was on the phone for half an hour to DVLA, get through, they just hung up. At that point, I was like...
That doesn't surprise me.
Welcome to Next in Line. I'm Sophie Cooper and I'm joined by my mum, Lesley Reynolds. On our podcast, we're talking about everything aesthetics, beauty and running our clinic.
And if I can just butt in and say, we're not sponsored. Nobody pays us to mention their products or anything at all. So we would ask you if you think anybody would like to watch this or help find anything about their skin, whatever they want to know, please share with them. Thank you.
Hey, so tell us, what have you been up to this week?
Well, I've had a really busy week this week, normal sort of week. Big thing for me this week was I downloaded an app to do some exercise. So I thought, right, I've done this before and I never do it. What exercise would I really like to do? And what I love is I love dancing. And I particularly love country music and country dancing. So I thought, when I say country dancing, country and western dancing. So I downloaded this app and the girl comes out and she's like, right, swing your partners. It's a bit like that. So I thought, well, this is going to be easy. I'll do that. Oh my God. I've been in agony. So it starts actually, you stand with your legs sort of shoulder apart, you know, and then she says, roll your shoulders. So you start rolling your shoulders and then you roll the other way and then you start stepping to the side and swinging your hips. And my back is killing me. My back's killing me. My shoulders feel. Why are my shoulders so sore? And I was in the shower. I thought, oh, my shoulders feel really sore. And then I realised what it was.
How long is it? How long do you do the session?
Well, you decide 5, 10, 15, 20 minutes. So, you know, I started.
Do you wear your cowboy boots?
I wear my cowboy boots and I've got this fringed long jacket. It's full length. I wore it where I went out. I think you'd laugh.
Put that on for it, for your
I
exercise.
put it on today to show everyone. So I put it on there.
Please
and
do.
And because it swings, you see, when you see all the fringing swinging, it sort of gets you in the mood for
you
it more.
were at my house, you popped in for a coffee and you were showing Arabella,
I was showing Arabella how
she
to
was
do it.
like,
She was like, are you crazy?
Where did you get her from?
I hope then I chose her. But it's actually a really good little workout because it does.
Because you enjoy it.
I love it.
Yeah.
I absolutely love it. But having said that, I didn't do it yesterday because I was quite achy. So I thought perhaps I'd do it every other day because I'm a complete non-exerciser. I walk, but that's it. I don't do anything else. But this shoulder rolling and swinging your hips and moving to the left and moving to the right. It's really lovely.
Good, it's good to get moving, isn't it?
It's great. I said to Alma, why don't you come and do it with me? He said, He likes laying on the floor doing all his push-ups and everything, you know, because he's athletic, isn't he? I'm not. But I love it, really love it. I like all sorts. I like ballroom dancing.
You love dancing,
We
don't
used to go to dance lessons, ballroom dancing lessons, and we really enjoyed it.
I've got a cute video on my phone. It always pops up. And in Harley Street, of you two dancing out in the waiting room, and I'm like filming you, like, what are they doing?
Practicing, slow, quick, slow. Yeah, so that's taken up a lot of my time trying to get into this exercise this week.
That's good.
The other thing that I've got very involved with this week is my alpacas because, you know, we had these 3 that had been badly treated and they're poor little things. Your heart really goes out to them. Yeah. And they have actually really started to get a lot friendlier. So Clay's or the boys in the grounds have named them Snap, Crackle and Pop.
I went down to see them this morning and I saw the chickens and I went to see them. And one is a bit more social. We came up.
Yeah.
One of them stood at the gate with its mouth like this.
Ooh, right,
and I was like, he was looking at, just staring at me like, what are you doing?
Yeah. So when I was in there yesterday feeding the chickens, we feed the chickens first because they make so much noise. And I call that one that goes Pop. And Pop was just standing watching me feeding the chickens. He was, what's going on over here? But then he was eating. They're getting really friendly. They come up close to you now because they know we're not going to hurt them. And it's taken time, but they are lovely. Anyway, so that's what I've been up to this week. Sophie, what have you been up to?
What have I been up to? I've had a nightmare with my car. So, it got towed on Christmas Eve.
Yeah.
And I still haven't got it back.
It's ridiculous.
I had to go and hire a car.
Ridiculous.
Disgusting, isn't it?
Disgusting. Did they pay for you to hire the car?
Oh, it was a big problem. Big problem. But so no, I had to hire a car myself. Mm-hmm. So Dan said to me, just go on and hire a car. I was like, okay, easy. We were in the office at home working. I was like, hire a car. Picked it. And I thought, I've never hired a car before. Have you?
No, you should get someone to do it for me.
So
how have you got a man that does this for you?
No, I thought I'm going to do it. I can do it. So I went on.
Okay.
Half an hour away, so drove there. I booked it all online, got there. Said to Dan, it will take us, we'll just pick it up, take us 10 minutes. Mm-hmm. So we got there, we go in. Mm. It was when it was snowing and icy, so the roads were awful. We were in our little Mini, sliding all over the place on the back road.
Right. That's dangerous, actually. You've got to be very careful.
Those roads, where we live, the roads can be so icy.
So did you hire a four-wheel drive?
Well, no, I just hired a normal. Well, it was a four-wheel thing. Mm. You get there and the lady said, have you got your booking confirmation? And I was like, oh no. She was like, why not? And I was like, because I don't have it. Like, she was starting to have a go at me. And I was like, I didn't get an email. She was like, okay, I just need your utility bill, your driving license, your proof of address, another proof of address and something else. And I'm like, I've just rocked up with Dan to get the car. And I was like, she was like, did you read all the things you need to bring? And have you checked in? I was like, oh no. So I need your DVLA check code. I was like, Dan was looking at me like, I said, well, you could have done it.
I think, now this sounds sexist, but that is a man sort of thing to do, isn't it? Do you not think?
So we're then...
Our brains work differently.
So literally, we walked in, there was no one in there, then about 5 other people walked in. I was like, oh, we were there an hour and a half.
So they went in front of you, did they?
Yeah, I was on the phone.
They had their booking things in order.
On the phone to DVLA, you have to have a check code. Dan's one, my one didn't work. The lady was like, have you got any points on your licence? I was like, no, I don't think so. Bloody hell. Then I was nervous. Mm-hmm. So I was on the phone for half an hour to DVLA, get through, the signal's bag, and they just hung up. At that point, I was like,
surprise me.
Should we just go home? I was like, I'm going to lose it.
Did you go home or did you buy something?
I called again. I was like, let's be calm. Called again, got my code, got the car. But the woman was really shirty.
Was she?
And I was like...
Was it a big company?
Then Dan was like, why were you two getting shirty with each other? And I was like, just wanted the car. And knowing someone's not helpful.
I can't imagine you getting shirty first, although, I suppose hormones can run rife at times, can't they?
So anyway, we got the car, but Dan was like, only you, It's like when I went to Paris and in my suitcase just packed a leotard. He was like, why do you do these things? I was like, I don't know, it just happened.
And then you got the hump, didn't you? Because you only have one pair of trousers to wear.
Yeah. No, I didn't have any trousers. I had a leotard.
What did you wear on your legs?
I was wearing a skirt.
And you had to wear a skirt and a leotard.
Yeah. But that's all I had with the anyway. That's another story. It's all these. So we got our car, but we still haven't got our car back. It's been ridiculous. You don't realise how much stuff you can fit into a Mini Cooper. Today we had Dan and I, the 2 kids, all their school stuff, forest school, 2 chihuahuas, and some lovely African land snails that you've got ready. So thanks.
Well, Freddie did ask me for those. I said, what do you want for your birthday? And he said, come with me in the study and close the door and don't let your daughter in. Your daughter, my daughter being your mum.
I saw him peeking through the door at me.
Is your daughter looking, he said. And then he closed the door. Then he came and sat on my lap, so I knew that he would want something because he was being friendly. So he sat on my lap and said, for my birthday, I want you to get me 2 African land snails, a heat pad, a tank, earth, moss. He gave me a whole list of things that he needed. I mean, he researched it really well.
Oh, he knows all about it.
For a 6-year-old, he knows more about African land snails than I know about most things. Yeah, he'd researched everything. So, and then he wanted some tumbling monkeys and some jungle wallpaper for his bedroom. And then he told me I could let my daughter in if I wanted to.
And you literally left my house, went straight and found 2 African land snails.
Well, I had to, quite hard to find, I had to go to, I can't remember where I went to, Whichford. I found a few places, put African land snails for sale near here. And the first place they said they had them, but apparently I hadn't phoned them. I'd phoned the other place, but I thought I'd phoned this place. I got there and they said, no, we haven't got any. Well, they did have some, but they were tiny.
Yeah.
And Freddie had been very specific. They had to be the size of his hand. So I found them.
So we've been researching a lot about African land snails. Yeah. I know everything. We know everything.
Dan did actually say to me, he doesn't want any, right? So this is where you need to be more specific, because when you and Dan say, I don't want them, or we don't want them, or don't buy them for us, I'm not buying them for you. I'm actually buying them for the child.
You're not, though, because we have to look after them.
Well, that's normal. That's what parents do. That's part of being a parent, isn't it?
It is.
Isn't
it is.
Yeah.
It is. I had to actually, because I was saying to Freddie, oh, they're disgusting. Oh, I don't like them. And everyone was kind of like, they're disgusting. And I could see his little face. He really loves them.
He loves them.
So this morning I said, I can't wait to see your African land
I've
snails.
had them 2 days now in a tank in my kitchen. And Armour this morning woke up early and said, I'm just going to go and make sure the snails are okay. But they are quite interesting. I mean, they are, watching them slide along the glass roof is a bit disgusting.
Well, because on the last podcast, you were talking about all your snail slime you've been using from Korea. I thought you'd just gone a bit.
Yeah, what do you think? Oh, well,
let that go all over your face.
No, I wouldn't let that go all over my face, I can tell you. And they've got bacteria, haven't they? They've got all sorts of things. Anyway, I've been touching everything with rubber gloves on.
No, you have to have wet hands when you hold them.
No, I don't hold them.
Oh, okay.
I've got a big pair of tongs you can pick them up with and move them
You
around.
can't pick them up with tongs.
You can.
Oh.
Anyway.
Moving on.
I pick them up. You have to be very careful not to pull them off anything because you can hurt them. But I've just been moving them around like this gently. I've only moved them twice. They eat huge amounts, carrots, lettuce. Anyway, what's this got to do with skin?
So talking about snail slime kind of fits in very well with our podcast today, all about what nobody tells you about your skin, about dermatology.
Yeah. And I have been using this snail slime on my skin. I don't know yet. I'm going to let you know in a couple of weeks' time what I think about that. But yes, so skin is a massive thing, as I've said to you, particularly at this time of year. Yeah. When everybody's sort of getting over Christmas, had a wild time at New Year, skin might be looking a bit dull and fragile, but mostly because people are looking forward to what's coming next. And that will be holidays, weddings. Yeah. So weddings are massive, aren't they? Yeah. At this time of year, people are preparing themselves for their wedding. So not only do you get the brides who want to, have really perfect skin on their wedding day. By the way, nobody has perfect skin. Nobody. People come in and
we can help you a lot, though, don't you?
We can help you a lot, but people come in and say, your skin's perfect. I say, no, it isn't.
Oh, I've got a dead leg, sorry.
We've got cramp. Been drinking bubbles.
Oh, I've got a dead leg. I'm so tall, don't worry, it's
so
okay.
Long. So nobody, you can't expect, when you expect to have perfect skin for your wedding day, it's a road to disaster, because if you do get a tiny pimple, it makes a huge difference to you. So you've got to think, get your skin as good as it can possibly be for you. Right? I
called you. Have you got any spot injection? I'm desperate need.
I'm sure we have. Obviously, spot injections are great for just before the wedding.
I think it's hard because now there's so many filters. Everything's so airbrushed. You see things and you have to make sure you realise that what is natural skin.
Exactly.
And you just want your skin to be as good as it can be for you.
Exactly.
And you can get it to an amazing place.
You can. I mean, your skin is definitely better. People say to me, I've been using this product for 5 days and already I can see a difference.
That's such a dead leg. I'm sorry.
Shall we massage it for you? It's really important that your expectation is to get it as good as you possibly can. And if you want a glow, the thing that I've discovered to really get that glow, this isn't just about medical dermatology, this is a bit more of an aesthetics thing, is the Hydra Boost, which is the hyaluronic acid product that we've got. It's got a few other things in it. And it gives you a glow and it holds your makeup on. It's what the makeup artists tell me, that when they use it on models, it keeps the makeup nice, looking good for hours. But I find it's the one thing that really gives me a glow.
So I think that dermatology, people often think it's really extreme and they're going to push you down the route of antibiotics straight away.
A lot of derms do.
But I think they're not always going to do that. It's only if you need it. What do you think?
Yeah. Well, I know, it's not what I think, I know the right way to approach it is to come in, have a consultation, go onto the Visio so we can see what's going on.
Yeah.
And you don't need to see a medical dermatologist if you're just looking at aesthetics, really.
Yeah.
But if you've got a problem with your skin, acne, rosacea, hyperpigmentation, eczema, moles that look a bit you're not sure about, that's when you need to see the derm.
Yeah.
And dermatologists will do, a lot of dermatologists are aesthetic as well as medical, but a lot of dermatologists will look at medication as an answer. I feel medication and treatments and skincare are the way it should always be. 3 things.
Well, I think if you're going to see a dermatologist and you do have to pay for their consultations.
Oh, yeah.
I don't think you'd ever see a dermatologist for free, would you?
No, I mean, dermatologists. So you do have to pay to see a dermatologist. You're paying for their time.
Of course.
If you go to the NHS, you'll probably have to wait months and months and months.
The wait list, I think we see so many people and they come in and they say, the waiting list is up to a year. And, I'm really worried. I want to get to the bottom of it.
Yeah, and particularly if somebody's got eczema, really severe acne or moles they're not sure about, you want to see someone fairly quickly, don't you?
Yeah.
And, dermatologists will charge anything from £200 for a consultation up to £500. That's not uncommon.
No.
But you're paying for the doctor's time. There's a really strange thing, I think. I don't know if you've encountered this as well, Sophie, but patients will come in and say, I want to see a doctor. And then you'll tell them about, the fee to see the doctor is now, why? And so my normal answer to them is, do you work? Yes. Do you get paid for working? Yes. Well, the doctors get paid for working. You have to pay the doctor. This isn't the NHS. It is a private practice. If you want to go and see a derm on the NHS, then go to your GP. Yeah. But the wait is such a long wait.
It is such a long wait. And I think, especially with severe skin disorders, you don't want to wait, do you? It's really especially the emotional toll that when people come in to see them in the state they're in, it's quite severe for them to have to wait. They'll normally pay whatever to come in and speak to someone and get solutions.
And I think that when you've got something like eczema or severe acne, you see girls and boys, but girls particularly will come in with their hair all over their face.
I had it at the weekend.
Did you?
There was about 5 or 6 consultations for acne, and one girl in particular came in, her hair was all over her face. She was probably about 20. Oh. And she wouldn't even talk or look at me.
It's so sad, isn't it?
She was just and she was in pain. She was lovely. We had a chat at the end, but she was it's just so sad to see. We see it all the time, don't we? With the hair over the face, no eye contact.
The pain, but it's, as you said, it's not just about how uncomfortable their skin is. It's about the emotional pain of not wanting to go out.
No confidence.
Why we became so interested in acne was because one of your brothers had a lot of acne. And he was, I don't want to go out the weekend because of my face. And it's horrible, isn't it? Girls pile on the makeup thinking they're hiding it, but sometimes that makes it look worse.
I think, though, girls, it's when you're for teenage acne, girls probably can cover it a little bit more.
Yes, and my best advice for that would be to use mineral makeup.
Mineral makeup.
Because it does cover well, it stays put, and you don't absorb it into your skin. So it's the best thing for makeup, for skin powder, mineral powder.
And I think a lot of girls that come in, or even just with acne, their skin is so dry, where they have used so many harsh products to try and dry it out.
Yes.
It makes it worse, doesn't it?
Yeah, and they get dry and flaky.
Yeah.
Yeah, but it's always a combination. I mean, it usually is skincare, the right skincare.
Yeah.
It's some medication often.
Yeah.
And then some treatments. That could be very mild peels. It could be some very deep cleansing facials. There's a whole plethora of treatments that you can recommend for people and put a good program together. But it's heartbreaking, and for boys as well.
Yeah.
But it's always hormones, isn't it? I mean, sometimes I see mums that come in and say, she doesn't wash her face properly. And it's, I'm a great face washer. But it's not just about cleaning. If somebody's got acne, it's not that they're being dirty. I'm not using the right things. It's usually because of their hormones. It's always because of the hormones. So seeing a dermatologist is really a very, very good start for that.
And I think, what do you think? Because now, obviously, you've got the Visio versus your dermatologist.
I think both.
Exactly. Isn't it amazing you can do both now?
I mean, our dermatologist does both, do the consultation, then does the visio. Because the visio is very good because it's also a starting point.
Yeah.
So 6 weeks later, you can see, has this improved? You know, is there as much bacteria there? Is the skin looking less red and
I think
inflamed?
people are very surprised when they go back on the visio to see the results. You don't always notice it, do you?
Well, I think
very gradual
you're looking at your
sometimes.
face every day, aren't you? I didn't notice I was aging for years.
Because you're not.
when you do the before and after, you do. Yeah, so it's a great way of people seeing that they're getting an improvement. It gives them hope as well.
Yeah. So I think he does that, and he also looks, doesn't he, with all his special tools that he has.
Yeah.
So he doesn't.
Yeah. And quite often it might be you need a blood test.
Yeah.
You know, for a lot of girls, it's polycystic ovary syndrome. There's a test for that now.
Yeah.
So you can do a test for that will tell you exactly what's happening with your body. And also the test will tell you how you can, so some things will work for it and some won't. Yeah. And that is specific to you.
And I think with medication, people are worried, aren't they, to go on antibiotics and different medication for acne.
Yes, but I'm really surprised that people are worried about going on to antibiotics, having antibiotics. So I don't want to have too many antibiotics. Can I have Accutane, which is a really, really strong drug that you do need to be careful of because it can cause depression.
You have to be so careful, don't you?
And the amount of people
pregnancy
pregnancy, and they don't have a blood test. So if you're taking Accutane, I was talking to Derm about it the other day, and he said a blood test every other month is really vital.
So he monitors you.
Yeah.
So you come in every month, have a blood test every month, make sure. So you're monitored the whole way through the course of Accutane.
Really important for Accutane. Yeah. But so I do find that more people come in and say, oh, I've got this acne, I've read about, I've done a lot of research and I want Accutane. Oh, I don't want antibiotics, they're bad for you. I'm thinking, well, really?
Yeah.
The other thing I do find, and I don't know if you notice this about people with acne, rosacea, pigmentation, hair loss, all these things, is a lot of people have done a lot of research and they come in and they say, I sit there and say, oh, I want this or that. I want, start to talk. And I've tried everything and I know I need this. And what I find with that is it's really silly to come in and say to a dermatologist, for instance, I know what I want, because the dermatologist knows far more about it than you.
Yeah.
So you know a lot about your body, you know a lot about what's going on with your skin, and you may have tried everything, but you may not have tried it in the right order. You may not have tried the right things together. And usually, they've been to the GP, had one blood test 6 years ago, and the GP's given me this, nothing works. And they are the hardest people to help because they think they know exactly everything about their skin and what they need.
It's hard, but I think when they come in, the dermatologists we work with, they're so experienced. They can guide you and actually explain in more depth than we would know or they would know, and make the right treatment plan. And I think if you're going to come in, you've got to try and be open to listening.
There's no point in spending your money or coming in and telling us what you want, because we may well have more experience than you do. And also, you do have to follow the program properly. So that's the other thing. You get people who come back 6 months later. Oh, it didn't work. Okay, well, you didn't come back for your review. And are you still using the products? Yes, I'm still using them. You've got product left. Yes. Did you buy any more? No, I'm still using that product. Well, then those products would only last for 10 to 12 weeks. So they haven't used them properly. So using products and being advised on them and using them properly is vital.
It's consistency, isn't it?
Yeah.
As soon as you're consistent with the skincare, it really, really helps. Yeah. And then if there's any other medication, it just all works in harmony, doesn't it? It's just a perfect mix.
And the other thing that I find as well is, particularly with younger girls and, coming with their parents, there is a budget and we have to be mindful of the budget. And I say, I hate saying to anybody, because somebody says to me, what's your budget? I think they're trying to find out what I want to spend. I don't like it.
Yeah.
So I don't say, what's your budget? I say, there are 3 things you could do here usually. And the combination of some skincare, some treatment. I like people to use the skincare for 2 weeks and have some treatment, then come back and decide, do we need to start using the antibiotics? Because quite often you can see quite a difference in 2 weeks if you're using the right things.
Yeah. The right one.
And I say, if you're going to be spending money, let's look at the best way to spend your money. So, because this is something that happens when I see people, they'll say, oh, I want to have a peel or I want to have a facial. And they may be spending a few £100s. And I say, you're actually better to be spending that money on the products that you can use that will last you for maybe 3 months. So let's start at that point. Or just have the products, but have one. Well, no, I don't usually start with the peel. I usually start with the deep cleansing facial. Have one deep cleansing facial and start with the products, because you need to get all the debris off the skin. Yeah. So that the products can sink in.
I think when you start something new, your skin can kind of have a purge, can't it? It can really break out, and people think, I'm going to stop that because it's breaking out, and you need to just carry on.
Yeah, but the most important thing you can ever do with your skin is what you do at home, a twice daily regime that will really make a difference. That's why I like people to spend their money on skincare first. And, if the budget is tight, I would say, what have you got at home? Show me everything or send me photos of it. And then I try to put the active ingredients in with what they're using.
Yeah.
You see, people don't wash their face properly. So I'm going to get back to this again, but people don't wash their face properly. And that is very important.
I think with dermatology, people always think they have to be covered head to toe in a really bad rash. It has to be really severe to see a dermatologist. But it's not, is it? It could be moles checks.
Massive mole checks. And that's really important, actually. Yeah. And, a lot of people come in and they have had a cancer, skin cancer. So it's very important to check it. But don't want to scaremonger people here.
No, but it's better to check, isn't it?
Absolutely.
If you're worried about anything, especially if moles have changed or any, you're just worried, get them checked.
Pearly sometimes. Yeah. Irregular edges. Oh, yeah, absolutely. If you think it's changed at all, or it's itchy, or it's getting bigger, definitely check it. Anything else you'd like to talk about?
Well, you've got cards as well.
I think said all mine, hasn't
I think a really good thing I'd like to talk about is adult acne.
Adult acne.
Because I think also, adult acne and acne after pregnancy.
Or during pregnancy.
Hormones. Bloody hormones. Give it a rest.
I know. A lot of girls do have polycystic ovaries, and that can cause hair growth, lots of hair in unwanted areas, which we can remove with intense pulse light treatment. Sometimes they find that their skin just erupts in acne, or they might just get a few spots. You can get spots on the chest and the back. And, of course, weight gain. Yeah. So they're all things that the dermatologist can help you with. Something I think that we haven't mentioned here, and I think is very important, is vitiligo, which is a loss of pigment in the skin. That's very, very distressing for people, where they will lose the colour of their skin will just go. Yeah. So whatever tone of skin, but, if you've got darker skin and you lose it.
That's autoimmune, isn't it, or not?
It's autoimmune, yeah. And there are tests you can do for that. And the dermatologists are doing fantastic. Well, our derms doing fantastic treatments for people with vitiligo, and it's a cream.
Is it a cream?
It's a cream, so it's a topical. It's not a terrible treatment. Yeah, so it's worth coming in to see somebody about it.
Definitely. But going back to adult acne, and things people don't realise. Obviously, it's things like inflammation, stress.
Yeah, stress is a terrible.
I think when people come in, they say, it's like I've got acne, but I can't have acne because they think it's a teenage thing, don't they?
Yeah, but also a lot of women will say, I had acne when I was a teenager. Now I'm dealing with acne and lines and wrinkles and anti-aging. And it's just too much for me. I think the worst thing probably is, if you've got spots all over your face and you're trying to cover them up, it's a big thing for people to deal with, isn't it?
I think when people don't realise. So when I was doing all the therapy, when I was probably 18, 19, you've always been drawn to acne, haven't you? And wanting to help people with it.
I have, and that's as I said, because one of your brothers actually had a lot of acne, and he found it really upsetting. And that's when I very first started getting into AHAs, glycolics, peels. And actually, if you get onto the right skincare and you have a course of peels weekly, very mild peel, so that your skin's not flaking dreadfully, because that's hard to cope with as well. So you've got spots and your skin's peeling. So very mild glycolic. I love glycolic peels, and you can do
PDT.
Mild, and PDT,
calms it down
therapy. Yeah, takes down the irritation, the redness. But you can get a big improvement in 6 to 8 weeks if you do that.
Do you remember we used to do so many case studies?
Yeah.
And I remember one girl in particular, her skin, it was red raw, just to cleanse it, would hurt her, and it would ooze. And Her skin was incredible.
Yeah,
what we did with her
completely cleared
skin.
it. Yeah, completely cleared her skin. Yeah, she was a lovely girl, wasn't
Was
she?
she on medication as well, or did you start?
I know exactly what she had, actually. She had AHA skincare. She had the whole pack skincare. She had peels. So you'd use the skincare for 2 weeks to acclimatise the skin.
And she did it religiously because it affected her so much. Yeah.
And then she had a peel every week, a 30% peel every week for 6 weeks.
Yeah.
And she had a course of antibiotics as well.
Her skin, from where it was, her pictures were incredible.
Yeah. And then she did have some scarring because obviously when you've got really severe acne, it will damage the skin. And then what we did was some laser, CO2 laser, and a little bit of fat transfer. And her skin was really smooth.
Did she have subcision or not?
She had some subcision, where you go under the skin and lift it for where the skin is stuck at low level, and you lift the skin, and then
It's
put
incredible.
fat under that layer of skin. It made it really smooth. It was beautiful, wasn't it? With some PRP as
Because
well.
that's the problem. You sort out all these people going through these awful skin conditions. You sort out the acne, then you're left with awful scarring.
You have to. It's a journey.
Yeah.
So the first thing is to reduce the acne, get the skin nice and smooth and healthy, as smooth as you can, stop the inflammation, stop the acne, and then you can deal with the scarring.
Maintain your skin, can't you? And then scarring. But I think it's so rewarding when you see the difference and you see their confidence come back.
I used to love doing the acne clinic. That was a really I didn't love seeing the kids with the acne. No. I loved seeing the results that we could get.
And I like it when something's not working or it's not going quite how you want it, to change something and then it works for that person.
Yeah.
What about rosacea? I think rosacea is a massive thing.
Rosacea is massive, and it's something that doesn't go away. It gets worse during the menopause for women. And it has to be controlled. You can control it. We found a really good program to control it. Again, 3 things. So the right skincare, some medication, but the right medication for you, which we find out from blood tests and doing tests.
What do you say if people don't want to take medication?
Well, you won't really get rid of it. Like, we can help you as much as we can. I mean, you can lead a horse to water, but you can't make it drink, can you? That's what I always say. So I find it very frustrating when people come for advice and say, no, I don't know. I think I'll research. I'm not really sure about that. And I think, why have you come to see somebody who knows what they're talking about, but you don't want to?
You do have to trust a little bit, don't you? And
you do. But PDT, IPL, intense pulse light, PDT, photodynamic therapy, both take down the inflammation, kill the bacteria.
Yeah.
There are masks that you can use at home that will help, but the right skincare. Sometimes medication is needed.
Yeah.
That's where derms come in. A dermatologist really can help you. You can come and see one of us and talk to us about it, and we can say this is what you need, but we can't prescribe.
It needs medical management, doesn't it?
It needs management. And you need to be dedicated to coming back to your appointments, to your reviews every 6 weeks as well.
I think I've seen some really severe cases where their nose almost looks completely red and you can't even cover it.
Sometimes it's quite bulbous, isn't it, as well?
And blotchy as well. It can.
Yeah, and sometimes they do need radiofrequency with it as well.
And things like foods affect it, don't they? There's so many things that affect rosacea.
The first thing we always ask people is, when you drink a hot drink, do you flush?
Yeah.
Does spicy food affect you? So we go through a whole list of things like that, and that starts to narrow it down.
Yeah. Mineral makeup's great for covering it. I can't.
You can make somebody with rosacea, if the rosacea is just the redness, you can use mineral makeup. I usually just do half the face so they can see in the mirror and you can't see a thing.
Yeah.
And actually it's quite calming because it's also got lavender in it. So,
because I think with people with rosacea, they just want soothing things. They always, I just want soothing creams, but you do need to go and talk to someone.
To the bottom. I think with all these things, you need to get to the bottom of it. And that's why tests are so important.
100%.
Yeah.
They really are.
Diagnostics are where it really all comes from. Eczema is a terrible thing for people as well. Eczema.
Oh, Freddie,
psoriasis.
my Freddie, when he was little.
Yeah.
He had the worst outbreak. His skin, wasn't it awful?
It was terrible. And I can remember somebody at your school, her brother had it, and the child, she just put mitts on him to stop him scratching his face. But this is often gut related.
Yeah,
see, it's
100%.
autoimmune.
When I think we have, don't we, the nutritionist does all the tests. If you can do that as well, if you're going to go on this journey to sort your skin out once and for all, to have all the tests and to do the whole picture, do the gut tests, take the supplements that you're needed. Because, and the bacteria from these tests, the bacteria that you have, it's crazy, isn't it?
They say that your gut is your second brain. And when we advise people when they've come in with terrible acne or rosacea, psoriasis, so many different things are autoimmune, we always recommend them having a gut test. But it's understanding what the gut test is saying to you, because you can have a gut test. You can all different prices of a gut test, and you can get one that's sent to you and doesn't really tell you very much.
Well, I had someone at a consultation. He said to me, "Well, I've done all my gut tests. I did it really cheap online, but I can't understand them. Can you tell me?" And I said, "Well, I can't tell you. You'd need to come and see a nutritionist or the doctor." And he said, "Well, I don't want to pay for that." And I was like, "Well,
stick with your rosacea then." It's choices, isn't it?
No, but I think if you're going to do it, I swear by the gut test, because I've seen results with Freddie. There's proof, isn't there?
It was like a different child within 6 weeks.
Yeah.
Was it?
6 weeks, I would say.
Yeah.
His skin was so bad, wasn't it?
It wasn't just his skin, it was his behaviour, how he felt, wasn't it? He was miserable. Imagine if your skin's hurting you.
He wouldn't sleep, he was up all night. Yeah. He had really bad tummy pains, you know, and all these things.
I mean, you can help. There's help there, but you have to find the right help, and you have to go all the way through. You have to have the test, and you have to have it diagnosed for you. Yeah. And then you have to be told, right, this is the diagnosis, and this is what will help it. But people, I think, do a lot of guesswork. So they'll take a supplement, they'll take something, an acidophilus for their guts, and think, oh, that's working. But it might not be the right one.
There's so many supplements out there at the moment, aren't there? It's like, where do you even start? And I think if you're taking stuff that you don't know your body's missing, you just think, oh, try that, try this. Well, I do. But I think once you know, right, with the test, he was on about so many different open the capsules up and put it in his drink. So he'd have that one in the morning.
How old was he? 3?
Must have been 2, 3.
Yeah.
His eye contact came back, and the nursery said he's actually looking at us. There's one supplement that it's to do with eye contact.
Yeah.
And it's linked with autism, isn't it? And things like this one. And it was just incredible. Then I thought, well, sure, this isn't going to work. I'm not going to lie, I didn't think it would work. Everyone noticed such an improvement the whole way through. He started really talking, didn't he?
Yeah.
He wish he wasn't talking.
Well, he was miserable because he must have felt so awful. Yeah. With his tummy, with his skin, no sleep. You know, he must have just felt so dreadful.
The nutritionist actually said about this bath, you put it in the bath, and it's like an oil. It doesn't look like an oil, but when you put it in the bath, it's an oil. That soothed his skin. So I think it was a Vino.
Was it a Vino?
I love a Vino.
I love a Vino.
They do some amazing things for kids.
No, it is very, very good. And I think, you know, looking at their food that they eat and trying to give them, you know, healthy foods, but you can make healthy foods really interesting and nice for them. It doesn't have to be horrible, does it?
Okay, I've got some viewer questions.
Oh, come on then. I love viewers' questions, yeah.
Has dealing with a skin issue ever affected your confidence more than you expected?
Me personally?
Yeah.
I have never had any skin issues, to be honest with you. When I was a teenager, I had like the very occasional spot. The thing that's affected my confidence more than anything has been ageing.
Your wrinkles here.
My wrinkles here. I absolutely hated them. Yeah. Well, I still hate them, but I mean, I'm getting used to them. I'm living with them a bit more, but I'm doing I'm trying lots of different creams and things and treatments to see.
Dear Lesley, I Googled my skin symptoms and now Google thinks I'm dying. Should I trust my face or the internet?
No. I don't think you should trust anything purely to Google. I think it's fine looking things up and getting a bit of advice. But if it looks like you feel, oh, Google thinks I'm dying, that's a bit of a worry, isn't it? So I think Google can be very, very, I think all these things, ChatGPT, all of them, I think they can all be very dangerous. I think what you need to do is go and see a specialist. Go and see your GP, who probably will say it's an anti-aging issue, don't worry about it. And then go to a clinic and see a dermatologist or a doctor, an aesthetics doctor. But don't diagnose yourself on Google. It's very dangerous, I think.
I feel embarrassed going to see a dermatologist because I think my skin problem isn't bad enough. Am I overthinking it?
I think you're probably overthinking it. And if you feel that you want to go and speak to somebody, there are very few dermatologists these days who will say, oh, you're wasting my time. I think that's something that used to happen.
Really?
Yeah, it used to happen. I remember going to see a dermatologist with somebody who had a lot of age spots. She was a golfer. She had a lot of age spots. She wanted to do something about it. And so I said, oh, there's a good dermatologist I know. This is like 25 years ago. And I booked in to see this dermatologist. She was like, they're age spots, you know, haven't got cancer. Why are you here? Which is a dreadful way to treat anybody anyway. But nobody would say that to you now.
But I think dermatologists are there to spot things if they're really dangerous or not.
Absolutely.
So when they're not, I think people can get a bit upset and feel like, oh, they've made me feel like I've wasted their time. But they're so, I think it's the way they should fluff it up a bit.
I think a lot of dermatologists
They do now, don't they? I couldn't hear them saying that now.
Dermatologists say, no, absolutely nothing wrong with that. But if you don't like it, we can give you this cream, we can do laser.
There's hope.
CO2.
There's something we can always
do. Yeah. So I don't think you should ever be embarrassed about going to see a specialist about something. You should just go in and, I mean, I can remember once actually, I was embarrassed once because I've got really large glands under my chin. And I thought, well, do I need a neck lift or can I get rid of these lumps? And I went to see an ENT guy and I said, somebody told me you can shave these. And he said, don't be ridiculous. He did say that to me actually. Don't be ridiculous, Lesley. He said, if we shave your glands away, your mouth won't produce enough saliva. So you just have to live with lumpy, bumpy glands. So,
Lumpy, bumpy.
And if I have a neck lift, they'll just look bigger, won't they? And he said, yes. So that was one thing. But you shouldn't be embarrassed. And actually, doctors, dermatologists shouldn't make you feel embarrassed about something.
No, never.
You should just be able to talk about it.
Can stress and hormones really affect your skin?
Yes, absolutely, categorically yes. This is where some doctors and dermatologists may go wrong because they just go yes. But you want to know why. You want to know why. You want to know what you can do about it. But stress is the worst thing for your skin, for your health, for everything, for your hair. So because you produce a lot of cortisol, so stress hormones are not what you want. So then I think you need to talk about why you're stressed. Can you do anything about the stress? Is there some way that you can have more, can you meditate? Can you exercise? I mean, I know we've spoken about this between ourselves, haven't we? And for me, it's always meditation. And for you, it's exercise, isn't it?
Yeah.
Exercise helps your stress levels. For me, it's meditation, puts me into a completely different sphere.
Yeah. That's how I feel with exercise.
When you exercise, yeah.
Funny, isn't it?
Yeah. Well, I have to say, my country dancing, my country western dancing helps me feel like that.
You.
Yeah. How do you know when a skin issue needs medical help rather than just better skincare?
Because I think we just know, don't we, when we see you, we can tell if you actually, so everyone can come in to see us free of charge, go through your skin care, physio. If there's a problem that we can't fix, then we guide you in the right direction of who to see, who will be able to help you.
Absolutely, if you need medication. And some people come in with a rash, don't they?
Yeah,
it's got
we
nothing
can't
to do with the skincare. Well, you can get skincare for a rash from using skincare that's too strong for you. But that's good. Now I've got another question for you. What's the most common skin problem you see that people wait far too long to get checked?
Probably acne.
I agree, acne.
People say, I've tried everything. I've tried everything. Then once they're on treatment with us, they say, I wish I'd come in sooner.
Yeah.
So I think acne.
And I have people that say, my cousin came to you 6 years ago and she said, go and see you.
Yeah.
But I think also people tend to say to their kids, well, you've just got acne, or all teenagers get acne. I say, don't let the acne get too bad. Start earlier rather than later.
Definitely.
Right, another viewer's question for you, and that's what's the biggest skincare crime you see that people genuinely think is helping?
Skincare
Crime.
Picking skin. Having a good old pick at the skin and then
Squeezing spots.
I mean, I have done that, but
Are you a spot squeezer?
yeah. I think that's a big thing that is really trying not to do it. Really, really try not to.
Because we do offer spot injections.
And also it can be really dangerous, especially for your eye. If you get any in your temples or your nose.
Around this area, yeah.
It's really, you have to be really careful not to squeeze it and make it get an infection or anything from it.
Because when you squeeze, apparently you squeeze some out and you squeeze some further down. And that's why a lot of people say, I keep getting a spot in the same place.
Yeah.
Because they've squeezed some of it down, it just grows and comes back up. So would you say a spot injection is a good idea?
Oh, I love a spot. I need a spot injection right now. Yeah.
Does it hurt?
When you have a spot injection, the relief is, it's the best thing. So it just goes down.
What is a spot injection? Does it get rid of the spot? What does it do?
Yeah, it takes down any inflammation in that area. So you can have, if you've got a few spots suddenly come up, just inject them. The doctor injects them and it goes down within instantly, I would say.
Really?
Pressure goes down and then within 24 hours it should completely nearly go.
And of course, if you do that, it is the inflammation that causes the scarring, isn't it?
Yeah.
So it stops you getting a scar. So if your skin is a bit darker, Mediterranean and onwards, your skin will get a brown mark. So it will stop the brown mark, stop that scarring. If your skin's lighter, you get a purpley mark, it stops that.
Yeah.
And I mean, I haven't had a spot injection, but I know a couple of people who've said that the doctor at the same time did the spot injection and he extracted the pus as well.
Yeah.
Drains
if it's
it.
really bad.
Yeah.
If it's really bad, like cyst kind of.
So it's a great thing to do if you. Well, it's a great thing to do to stop you getting any scarring, but it's also a great thing to do if you've got a big event coming up.
I think people think it's silly, but it's really not because it's painful. Especially, I keep getting them in my jaw area under the skin, and they are so painful. The minute you have it injected,
that's very hormonal, isn't it?
Yeah, it goes right down.
What's one thing people do to their skin that makes you quietly think, please stop immediately?
It's got to be back to skin picking, hasn't it? Squeezing, picking your skin. Just make it much worse and actually leave scars. So I think that. And also makeup.
Makeup? What, wearing it?
Yeah.
What, when you've got a spotty face, wearing makeup, is that a bad thing to do?
Making sure, I think the mineral makeup, wearing makeup, you see the girls come in, they're packing it on to try and hide it. But when we show them the mineral makeup, it's light, it doesn't go into your skin.
Don't absorb it because the molecules are large.
So big. Kathy, I just hear her. The molecules are so big, it can't go into your skin, so it sits on the surface.
Yeah.
I think that's, so covering up with the wrong colour and loads of it just makes it look much worse.
Actually, I was a culprit of wearing the wrong colour makeup for years.
Oh yeah,
I love it. For years and years, I wanted to tan. So I'd wear fake tan and wear dark makeup. But actually, since I've given it up, I think it's better.
You have given up fake tan, haven't you?
Given up fake tan. Given up fake tan. Because I suddenly thought, why am I trying to be a different colour when actually I am just pale? I'll be pale and interesting. So I'm just pale. And now I think I've got the right colour makeup.
You do.
So hopefully.
Right, 30s versus 70s. Leave a comment for a chance to be featured in a future episode of the podcast. So 30s versus 70s.
Yeah.
I want to ask you, what's the one thing you wish you had or you hadn't done with your skin?
Wish I had or hadn't done. I wish actually that I had started using skincare earlier and taking more care of my skin.
Yeah.
I've had to do a lot of makeup time for that. When I say making up time, I've had to put a lot more effort in. And the one thing that I wish I hadn't done is sunbathed the way I did. I mean, until I was 40, I had a sunbed in my bedroom, top and bottom. I'd go to the sun booths, tanning booths. And I've got a lot on the Visio. It shows you what damage you've got to your skin. I've got a lot of sun damage deep down.
Have you?
Yeah. So that's why I take extra special care of my skin. I haven't sat in the sun and sun exposed my face or this.
You don't, do you?
No,
when we were on holiday.
Since I had you. So I was about 38, 39 then. So since then, but before that, I was absolutely as brown as a berry all the time. And I didn't particularly bother too much about moisturisers and things, I wasn't exactly an oil and vinegar girl that people used to put on their bodies to make them look brown. But I'd use like SPF factor 8, whereas my mum never sunbathed. And her skin, same as my granny, when they died, 80.
Her skin was amazing.
Skin was amazing.
I think the sun is one of the worst things you can do.
Yeah, it's
for your skin.
absolutely the worst thing. And I think if you are going to, I mean, I went on holiday in October and I just let my legs have a bit of sun because it felt quite nice. But I'm always really careful about my face.
I am really careful. One thing I am really good when I go on holiday is my face.
Suntan.
Face, neck.
Yeah.
I do let myself get a tan
50?
on my body. I put obviously sun cream on, but 50 always on my face. I'm religious
And
with
you
that.
should do it on your hands and your
And a
neck.
hat. Yeah.
Yeah.
Definitely.
Yeah. I've actually bought some really nice scarf things. I'll bring them on next week maybe. You tie them at the side, then you put a hat on and it keeps your hair. Because your hair gets really damaged as well from the sun.
Does it?
Yeah.
I didn't know that. Bloody hell.
I've told you in my 70s what I wish I hadn't done. In your 30s, is there anything that you wish you had or hadn't done when you were younger?
When I was younger, I think I had filler
Too early.
here, and I probably didn't need it then.
Yeah.
And I probably wouldn't have it now.
Yeah, you
At
said
that
that to me
age.
before. How old were you?
I think I was 25.
Naughty Sophie.
Naughty. But I just didn't need it. And I thought, why am I doing that?
Why did you do it then?
Because I think you're constantly in the mirror, aren't you? What do I need?
Yeah.
At 25, like some people probably do. It depends, doesn't it, if you need it or not. I can't imagine anyone needing it really badly.
Well, you say that, but actually I saw about probably 5-10 years ago, huge amount of girls and boys as well that had been backpackers at 18, 19, gone off for a year to Australia or the Far East, hadn't used any sunscreen, really partied hard, and in their sort of mid to late 20s really started to look aged.
Really?
Yeah, but people have actually gone past that now.
Yeah.
And are so much better. So people are coming in at 28, 30, really just because they're aware, I can keep my skin like this. What can I do to prevent?
So one thing I'm really good with SPF 50 on holiday, and just every day I always put SPF on, and it's in my makeup, in the mineral makeup, which is amazing. So they're my two things that I would and I wouldn't. Thank you for watching. And are you off to do any more dancing?
Well, today's my day off, actually. Yesterday was my day off. Today I may just do 5 minutes, but I do love it. I can't wait to do it.
We'll see you next time.
Bye.